It's Dr. Bob. Welcome to Conquering Migraine. Today, we're going to talk about combination medicines. My team wanted me to talk about combination medicines because I'm always talking about the problems with them. But when I started to think about it, I want to talk about the benefits of them as well. So, like with anything, there are risks and benefits, complications, and synergies to be had. So let's talk about combination medicines. Most of the combination medicines we're going to be talking about are used for acute treatment, but some also are used for prevention. So let's talk about some of the common combination medicines on the market. So number one is Excedrin type medicines. Excedrin, Anacin, other things that are combinations of aspirin, acetaminophen, and caffeine. Now, if you don't have rebound headaches and you're not super sensitive to caffeine, caffeine is a purine analog, which just means that's the ring structure. It's like part of your DNA. The purines is one of the types of the molecules in the DNA that makes it up. And so it has some active components to stabilize blood vessels and also some pain relieving effect in that compound. So when you take aspirin plus caffeine or acetaminophen plus caffeine, or the combination of aspirin, acetaminophen, and caffeine, which is what many of the Excedrin products are together, you get a better headache relief. And so for years, I used Excedrin as my main headache medicine. I took prescription medicine sometimes when I needed them. I took preventive medicines, but a lot of times my go-to medicine, if I was getting a migraine early, was an Excedrin type medicine. And that worked for a long time until it didn't work. And then two things happened. The aspirin in the product can irritate your stomach. And so lots of people, a lot of my patients, a lot of my friends, and a lot of me in the past had stomach issues when I had migraine. And so I feel a little bit nauseated. I wouldn't really want to eat. I might be able to get some medicine down, but aspirin on an empty stomach increases the risk of causing a stomach ulcer or bleeding, as do other medicines like naproxen. And so I one time on a fishing trip took Excedrin for 3 days in a row while I was out fishing with nothing to eat, and I'm pretty sure I got a stomach ulcer that took like 6 months to heal. And so as you get older, each decade the risk of stomach ulcer goes up exponentially. If you've had one before, if you've had previous bleeding disorders, if you're sensitive to them, then that's a problem. And so I was able to go back and take this again for years, but there's also an acetaminophen caffeine version of Excedrin that used to be called like Excedrin tension headache, and some other generic versions of that as well for people who don't want to take the aspirin. Now, I actually think aspirin is one of the better non-steroidal drugs, and I like the little bit of blood thinning effect once in a while. I don't necessarily want it all the time, but like when you're traveling and things, aspirin decreases your risk of blood clots. For years we said, oh, no, it doesn't. It's just aspirin. And then they did some big studies that went, oh, oops, it does. And so that's like a lot of things in medicine. When we actually do larger studies and observe things in a controlled fashion, we learn stuff. And so we learned that the aspirin component does actually protect blood clots a little bit. But the big problem with combination medicines, aspirin, acetaminophen, caffeine, is that if you're starting to get headaches more frequently and you take them more than 9 days a month, that can lead to rebound. And like I've told you all before, I've had rebound headaches twice in my life. They lasted 1 to 6 months, and I had to cold turkey off of them and not use acute pain relievers during that time. And it was a problem. It really was messing up my function in my life. So I trudged on and dealt with it. But it is a significant problem. I also want to talk about the acetaminophen component. That's Tylenol or Panadol or many of the other brands or a lot of generics. And acetaminophen in some ways is more benign than aspirin because it doesn't cause bleeding. It doesn't cause asthma reactions like aspirin and Aleve and ibuprofen do in people who have aspirin-sensitive asthma, but it does interfere with a key compound in the body called glutathione. Glutathione is the main cellular antioxidant that protects the cells from things that damage them, like oxidation products or reactive oxygen species given off by our metabolism or by air pollution or other things. And so I've seen case studies in my functional medicine training where people were using high doses of acetaminophen. They might lose hearing, they might have head injuries, and then not go on to recover because they're out of this key glutathione component is one of the main theories why they didn't do that. So a little bit of acetaminophen is probably fine. A lot is hard on the liver, especially if you drink or have other liver problems. And in general, I don't like to deplete glutathione, so I try to avoid that when I can. So those are my concerns about Excedrin, as well as the good things about Excedrin. Just a once-in-a-while headache, probably stronger than regular aspirin, stronger than acetaminophen. The combination of aspirin, acetaminophen, and caffeine is powerful over-the-counter medicine. And when it's compared to some of the prescription medicines, for many people, it will do the same. If you give them blinded and they don't know which one they're taking, they may get good relief from either one. Now, there's a combination product called MigraRelief brand that has a number of ingredients in it, and this is one of the ones I complained to my team about some because it has an ingredient called Feverfew in it. Now, Feverfew is an herbal product. I don't believe it's dangerous, but the headache community believes that Feverfew may cause rebound headaches. And so when you take preventive medicines that have a component in them that might cause rebound, then you're sort of asking for trouble. Has this been proven? Not to my knowledge. I don't think that there's ever been a large systematic study of this. This is just when you hang out with headache doctors and you're talking about headache medicines, what have you seen? What have you observed? You know, there are some prescription drugs like venlafaxine, which is Effexor, that have a couple of studies done in Eastern Europe. I call them the best studies that money could buy because there's no studies in Europe or Australia or the United States or Canada, but that show it's effective. But many of us in headache medicine have seen with that medicine, people get more headaches and they're nasty. And so we generally recommend avoiding that and using a different agent if possible. Now, have I seen some people take it fine without headache bother? Yeah, but I've seen more bother than not, and so I avoid that. So that's the headache community gestalt wisdom. So a lot of headache doctors seeing a lot of patients, we believe that Feverfew may have a rebound component. Not proven, just believed from collective clinical experience of hundreds of headache doctors. Now, the other things in that product, depends on the particular version you get, are good things. They have some magnesium. I'm not sure it's at the dose that we generally would need, up in the 300 to 400 milligram range, but that magnesium is good. Vitamin B2 sometimes is a home run. It's a mitochondrial support drug. And so I like to say vitamin B2 is one of the first things I bought that made me feel like I was cool. Because I went to the store, bought the 400 milligrams of vitamin B2. They had it behind the counter and had one of those things on it, like, you know, that shows if you steal it or not. I thought, wow, usually the things I buy, like if I used to go to a record store and buy a CD, I'd buy the only CD in the place that didn't have one of those stealer things on it, because the cool people would like never even steal the music I bought. So when I bought 400 milligrams of vitamin B2, I thought, wow, I'm really doing something special. But I didn't have much luck with my migraines, and I haven't had much luck with my adult patients, but occasionally in our pediatric patients, we've done good things. And when you use combinations of medicines and supplements that support the mitochondria and programs that support the mitochondria, then having adequate B2 or using B2 therapeutically may make sense. But by itself, I haven't seen it make a huge difference. Some of the versions of MigraRelief also have boswellia in them, and boswellia is a good anti-inflammatory. I've not heard that it causes rebound, and it's good for inflammation, for joint pain, for neck pain, and there are also some evidence that it's good for certain types of indomethacin responsive headaches. So some kinds of headaches that don't respond to normal drugs will respond to this special anti-inflammatory called indomethacin that has a ring structure that's a lot like melatonin. So chemically it's like melatonin. And so there was a person who developed a product that had boswellia in it, studied it, and marketed it for headache for those other types of headaches like hemicrania continua and things like that. And so I think that's a very reasonable thing to add, so I don't have any issue with that. And then there's a menstrual version of it that has chaste tree in it. And chaste tree is a very interesting herbal product that is very good for women's problems, very good for menstrual type stuff, and we use that in our practice. So I think a lot of things in that ingredient are good. It's just the Feverfew I have a question about, and that's the key ingredient in all those formulations. Now I want to talk about Midrin. Midrin's been around for a while. It's been on and off the market. And it's a combination of three things. Acetaminophen, we talked about acetaminophen, my concern about the glutathione and depleting your antioxidant. It's got some isometheptane and some dichlorperazone. And so there's a muscle relaxer and a blood vessel stabilizer in it. The nice thing is there's been good research done, and when I worked at Mayo Clinic, we actually put this on the formulary for just to use the isometheptane because it doesn't cause rebound headaches. So we made that available, even though it wasn't available otherwise as a single ingredient. We compounded it for certain difficult headache patients. Somebody brought the data to our group. We studied and said, yes, but that's very reasonable. So isometheptane is a good headache medicine, doesn't cause rebound. Many people tolerate it, but it does have some vascular effects. So if you have cardiovascular disease, you want to read the label carefully and make sure it's okay for you. And then the dichlorperazone is a muscle relaxer. And so a mild muscle relaxer is good. I tend to use more specific muscle relaxers on a steady basis rather than just sort of a low dose with this. But a number of people have responded extremely well to Midrin or similar isometheptane combinations, and a number of people don't respond at all. So this one, other than not wanting people to take acetaminophen all the time, I don't really have a lot of problem with. I don't think it's likely to cause rebound, and if it's tolerated and you don't overuse it in terms of getting too much acetaminophen or getting in trouble from repeating doses, because even acetaminophen by itself can cause rebound. It's the isometheptane and the muscle relaxer that probably don't. So anything, aspirin, ibuprofen, Imitrex, Relpax, almost any headache drug can cause rebound. Isometheptane is an example of one that doesn't seem to. Then there's the headache doctor's nightmare, and that is Esgic or Fiorinol or Fioricet. And that's a combination of aspirin, butalbital, which is a barbiturate, and caffeine. There are some caffeine-free versions, and there are some aspirin-free versions that just have acetaminophen and butalbital. But butalbital is a very addictive barbiturate. And what I've seen over the years is a certain percentage of migraine patients have severe anxiety. And when they have severe anxiety and they've never had anything that helps it, and they get a barbiturate, they feel like, oh my gosh, this has really helped my anxiety. It helps me feel better. I've never felt better and less worried and less stressed. And so then they start overusing it. Well, butalbital and barbiturates in general are very addictive. And they're not only very addictive, but they tend to cause rebound headaches with as few as 3 doses a month. And then people who get addicted to butalbital, sometimes you can taper them down very, very slowly, but sometimes you have to even put them in the hospital to get them off of these types of drugs. And so this has been banned in Germany. Some of my headache partners, some of my headache subspecialty partners from around the country have had it banned in their hospital systems and taken off their formularies so people can't use it. And so docs are often looking for something that's not narcotic. And so they may just say, oh, well, at least they didn't give them a narcotic, which are also bad for headaches, cause a lot of rebound. And so they give them this. But I've seen people who've been on this drug for 30 years and can't get off. I've seen people whose relationship with butalbital is much more strong and much more intense and much more lasting than their relationship with their spouse. And so I think butalbital is a bad choice. I actually tried it years ago before we knew all this stuff. There's actually one of my old neurology textbooks I found, and it said for people with chronic headaches, you should put them on 2 of these 4 times a day. Well, I wasn't taking 2 4 times a day, but I would take it once in a while. And this was 30 years ago when I had more migraines. And what I noticed is I was dropping things the next day. And I thought, well, that's weird. I don't think I want to be doing that. So I stopped using it for that reason. Later to find out that it's one of the worst rebound drugs of all time. So those are the combination medicines that I wanted to talk about. The over-the-counter ones like Excedrin and Anacin and other combinations of aspirin and caffeine. Some of those headache powders that have aspirin and caffeine in them would do the same thing because the caffeine intensifies the rebound. So that's a concern. The Migraleaf may be very good for some people, but I'm a little concerned based on what I've heard from a collective group of other headache specialists that the Feverfew might cause rebound. The other ingredients in it may be very helpful. And so I don't think it's unreasonable to try it, but I think if you're getting in chronic headache land and you're getting worse and not getting better, then you would ask the question is, could the Feverfew be causing rebound headaches and keeping me in headache land? Then there's the Midrin, very special drug that's been on and off the market. It's been off the market because it went generic and there weren't many manufacturers. Then some manufacturers came on, then it went away again. So it's been difficult to get, but some people do extremely well with it. It seems to be safe for most people, although you want to read all the detailed product warnings. And again, I still recommend, because it has acetaminophen in it, limiting it to 9 days a month. Then the last one, which is the headache doctor's nightmare, is butalbital containing medicines. Esgic, Fiorinol, Fioricet, Axetol, those kinds of things that have butalbital, acetaminophen, maybe aspirin, and caffeine in it. And that is almost a sure recipe to get rebound headaches, if not addicted. So that's my wrap up on the good and the bad of combination medicines. Well, Dr. Bob, over and out. Great to see you guys, and y'all take care.